Welcome to The Explainer. Today we're going to take the latest medical guidelines and turn them into something you can actually use, a clear game plan for treating peripheral artery disease. So you, or maybe someone you love, has been diagnosed with PAD, and yeah, that can feel pretty overwhelming. But the good news is there is a clear, evidence-based game plan for managing it. We're going to walk through that whole strategy together, step by step, using the most up-to-date research. Okay, so here's how we're going to tackle this. Think of it like a pyramid. We're going to start with the foundation, the stuff you have to get right, and build our way up to the more specialized treatments. Let's jump in. So before we dive into all the what to-dos, let's get crystal clear on the why. What are we actually trying to accomplish here? Every single part of a good PAD treatment plan is shooting for a few really specific goals. And this is so important to get. Treatment isn't just about one thing. It's really a two-pronged attack, right? First, we want you to feel better now, to improve your day-to-day life. Think walking further, just feeling good. But at the exact same time, we're playing defense, working behind the scenes to protect you from the big, scary stuff down the road. Okay, let's get to the base of that pyramid we talked about. These are the absolute, non-negotiable game changers. Everything else we talk about is built right on top of this foundation. You really got to think of these three things as powerful medicine. I'm not kidding. Quitting smoking or any tobacco is probably the single biggest thing you can do. A heart-healthy diet, that helps you get a handle on all the underlying stuff. And exercise? Well, as we're about to see, a very specific kind of exercise is a frontline treatment for PAD symptoms. Now, this is a really key point. We're not just talking about, a casual stroll in the park. This is therapeutic exercise. As you can see, the gold standard is supervised exercise in a clinical setting. But don't worry, a structured program you do at home, one that your doctor maps out for you, can also be incredibly effective for helping you walk better and just feel better. And here's how it actually works. It might seem a little backwards at first, walking until you feel that pain. But this cycle of pushing it, then resting, is exactly what tells your body, hey, we need better blood flow down here. You're literally training your circulation to build new pathways. All right, we're moving up a level on the pyramid. Once you've got that solid lifestyle foundation, the next step is to get really serious about controlling three key medical conditions that are super closely tied to PAD. And this layer is all about what we call the big three: high blood pressure, high cholesterol, and diabetes. If you let these run wild, they are just wrecking your arteries. They speed up how fast PAD gets worse and crank up your risk for a heart attack or stroke. So yeah, getting them under control is absolutely critical. So this table, this is basically the modern playbook, and you can see the goals are super specific. For blood pressure, we're aiming for under 130/80, often with meds like an ACE inhibitor. For cholesterol, it's all about crushing that bad LDL cholesterol, usually with high-intensity statin. And for diabetes, well, the new guidelines are really pushing for newer meds like GLP-1 or SGLT2 agonists. Why? Because they don't just lower blood sugar, they actually protect your heart and blood vessels in a big way. It's a game changer. And hey, if you needed any more reason to really focus on managing diabetes, look at this number, 5 times. It just speaks for itself, right? Poor blood sugar control puts you at a way higher risk of serious PAD problems. It really shows you why working with your doctor on this is so important for protecting your limbs. Okay, so let's recap. We've got our lifestyle foundation, we're getting a handle on the big three. Now, your doctor might add some very specific medications to give you an extra layer of protection, ones that are targeted right at the mechanics of PAD itself. So the main target here is something with a big, fancy name, atherothrombosis. But all it really means is preventing a dangerous blood clot from forming on a plaque in your artery, because that's what causes a heart attack or stroke. Medications like aspirin are designed to make your blood platelets less sticky, which gets right in the way of that clotting process. It's a huge deal for lowering your risk. Now, this is where a really important conversation happens. For a lot of folks, a single anti-clotting drug like aspirin is the way to go. But for people who are at a higher risk, there's a more powerful option, combining low-dose rivaroxaban with aspirin. It offers even more protection. But, and this is a big but, there's a trade-off, a higher risk of bleeding. This is a perfect example of where you and your doctor really need to sit down and weigh the pros and cons for you specifically. So besides protecting you from those big events, there are also medications aimed squarely at making your day-to-day life better. And the main symptom we're talking about is claudication. That's just the medical term for that classic leg pain or cramping you get when you walk.
And for that specific problem, there's a specific medication we should talk about.
This timeline for a drug called xylostazol is great because it helps set expectations. This is not an instant fix, okay? You might start feeling a little better in about a month, but that 3-month mark, that's the real test. If it's not helping by then, it's probably not for you. But if it is working, the benefits can keep on building for up to 6 months. So patience is key here. All right, we've climbed all the way to the top of our pyramid. This is the part of the plan for when, even with all the lifestyle changes and medications, symptoms are still a major problem, or a limb is actually in danger. Revascularization. It's a big word, but it means exactly what it sounds like: restoring vascular flow or blood flow. Basically, a specialist goes in and physically opens up the blocked arteries in your legs. They might use little balloons or stents to prop the artery open, or sometimes even surgery to bypass the blockage. The goal is simple: get more blood where it needs to go. But, and this is really important, this isn't step one. These procedures are usually reserved for 2 main situations. 1, your symptoms are still so bad they're ruining your quality of life, even after you've tried everything else we've talked about. Or 2, and this is the more serious one, when the limb itself is at risk because the blood flow is just dangerously low. Okay, so let's wrap this all up by talking about how all these pieces fit together. Because the most successful pad treatment isn't just a list of instructions a doctor gives you, it's a partnership. It's something you and your healthcare team do together. I love this quote. It comes straight from the medical guidelines, and it really sums up the whole modern approach. Shared decision-making. That's the key. Your goals, what you're comfortable with, your tolerance for risk, it all matters. You are not a passenger here. You are a key member of the team making the calls. And this pyramid just brings it all home, doesn't it? It shows the whole strategy. You see how that strong foundation supports every single other level of treatment. You can't just jump to the top and hope for the best. Real, lasting success comes from building this thing from the ground up, starting with those incredibly powerful lifestyle changes at the very bottom. So, as we wrap this up, the most important question isn't about some fancy procedure at the peak of the pyramid. It's about your very first step at the bottom. I want you to look at that foundation. What's the one thing you can commit to starting today? Is it quitting tobacco? Making one small change to your diet? Or just starting that walking program? Because that is where your journey to taking control and feeling better really begins.